Good afternoon, ladies and gentlemen. My name is Gopi Ganisalingam.
Sorry.
Good afternoon, ladies and gentlemen. We'll do this again. Good afternoon, ladies and gentlemen. My name is Gopi Ganisalingam, one of the vice presidents at MDEC, Malaysia Digital Economy Corporation. The theme for this session is COVID-19, what data says about the future. COVID-19 is a very dear to all of us, as we're all facing the daily updates and hearing pain and suffering, both in Malaysia and the world. Not only those who have COVID-19 infection, but what is it causing to the livelihood of everyone and the economy as a whole? One of the ways that is deployed worldwide is to mitigate the spread of COVID-19 by using contact tracing and using the data collected to act quickly to detect and control the spread. I am sure that everyone is anticipating the daily updates on COVID-19. I know I am. And we will also monitor what is happening every day on the status as to how these data are collected and how it's being used in what we would like to discuss with our panelists in this track. Ladies and gentlemen, we are honored to have two distinguished panelists who are passionate to assist our government and to the public in this time of distress in terms of data collection and dissemination. I am pleased to introduce Dr. Lau Cher, founder, CoronaTracker, a chief data scientist by profession and the CEO of LEAD, where his current focus is on helping business enterprises to grow their data science teams. He's also launched the COVID19AI.org to use artificial intelligence to combat the coronavirus on a large scale. So very smart guy. Don't be mistaken. He is not a DJ. You look at the mic. Don't be mistaken. Our second panelist, young, handsome guy. Let us also welcome our second panelist, Dr. Helmi Zakariah, who he is presently assisting the Selangor State Task Force for COVID-19 as a lead digital epidemiology. He's also the Chief Executive Officer of AMI and AI for Good, where he led the delivery of data analytics solution in public health, women and reproductive health, and sustainable agriculture across 3 continents. In November 2019, Dr. Helmi was appointed as member of WHO ITU Working Group for AI in Outbreak, a multi-institutional and global platform aimed to leverage on machine learning to mitigate outbreaks. Gentlemen, welcome to the show. Gentlemen, I would like to ask each one of you to quickly introduce yourself and give us your background and what you do in related to COVID-19. We'll start with you, Dr. Helmi.
Hello, hi, afternoon, everyone. My name is Helmi Zakariah, and before being called into the Selangor Task Force, my day-to-day job is as the CEO of AMI, just like what Gopi mentioned just now. So what we do over here is that we leverage on big data and machine learning for epidemiology so that public health decision can be made timely and responsively. So our niche is in population health. We are not doing, all this diagnostic of cancer or whatnot. So our niche is in population health, and previously we focused on dengue, we focus on Zika, non-communicable disease, and women's health across Southeast Asia and the Caribbean. So in practice, our approach is to combine health and non-health data, such as weather, urban design, physical build, social viscosity, etc. And what we do is that we predict the occurrence of outbreak in advance so that resource allocation can be made strategically. So it means, because of the work that I've been involved in, it means that when the COVID-19 pandemic hit Malaysia, we had to be at the forefront, providing the data and insight to coordinate the government response. So specifically for COVID-19, at the moment, we operate 2 solutions. The first one is Selangor. I think many of you probably have seen those. And what it is like a citizen-driven, crowdsourced, cheap QR-based contact tracing platform. It now evolved into a multifunction ecosystem for overcrowding surveillance, SOP compliance monitoring, and also a rapid welfare allocation. And second, less known to the public, is that we also run a cluster prediction platform where we predict the trajectory of COVID-19 cluster. What we use is an inherent risk of contagion modeling, but I think I will talk about it a little bit more later then. Thank you.
Thank you, Doctor. Very interesting. So so you've been tracking all kinds of diseases right from the beginning. Interesting, very interesting. Dr. Lau.
All right, thank you very much.
Now.
Yep.
Once again, thank you, Gopi. Thank you, MDEC, for inviting me, and very interesting. Nice to meet you, Dr. Helmi, as well. I'm CEO of LEAD. So LEAD is an institute, is a tech institute. We train, focus on data scientists and then full stack engineers for the country. And I'm also the founder of CoronaTracker. I believe most of you have used that before. So briefly introduce the platform is we collect information and statistics that's related to coronavirus since the very beginning, I think late January. And then what we do is not only we collect structured data, we collect the numbers, we collect the stats that you see every day, but we also collect unstructured data like news information and other additional information that can help to enrich the model. So one of the things that we did with CoronaTracker is that we open up, we make it into an open source, not only just for the platform, but also for the data itself. Is enabled and available for 195 countries. So if you go into CoronaTracker and click on any countries like Malaysia, Singapore, you can see their daily reports, and also this data is available. So like researchers and countries that do not have the data platform yet, they actually rely on our data to use that for decision making, which I'll talk about in a short while as well.
Interesting, Dr. Lau. I understand that you kind of brought the platform in place somewhere in February this year.
Yes.
Right at the outbreak of outbreak of COVID-19.
Correct.
What made you go in there so early? Was that gut feeling, or did you think that it's going to explode? What made you go in so fast, so quickly to get this out? And you're one of the first in the world, I believe, to put a tracker in place.
Yeah, so part of the reason, I think, because I participated in a lot of hackathons in the past, right? So we sort of like, hey, this is an interesting thing. So if we can try to turn it into something that's workable, a prototype, or not even MVP, right? In a very short amount of time. So we built the first version in 36 hours. So with the startup spirit in my blood, in my DNA. So we thought, just launch it and then see what is the public response. And Gopi, you're right. We launched it before it has a proper name called COVID-19. So it was just called Wuhan virus. And in fact, many people who did similar things. So we are the only one that do it in such a large scale. They were us, they were World Info, and then the World Meter, and also Johns Hopkins University. These are the three.
So what made calling? Was it professional background made the calling, or was your entrepreneurship background that made that calling to go straight in?
I think more the entrepreneur side of me.
So if I look at both of you, Dr. Helmi and Dr. Lau, you going there, you're tracking, and Dr. Helmi, am I right to say that you complement the whole thing because you're using your data, your unstructured data as well to look at patterns and advise how the virus is breaking through?
Exactly. And one of our concerns, like when I joined the WHO and IPU outbreaks global study, right? And one of the things that we discover is that for a lot of people, and for a lot of health professionals, they like to see health on the perspective of health. So I think the last meeting that I had with them is on the 25th of January. I was in Brazil at that point of time, and we were discussing about this disease X. At that point of time, like you say, it haven't had any proper name, but people have modeled what are the characteristics of disease X, and it seems like disease X is what going to cause a global pandemic very soon, and these are the characteristics of disease X, that it would have to be a respiratory disease, that it can be transmitted through an asymptomatic carrier, that it most probably originated from animal, that is then jumped to human, and that is probably have what we call like it go coincide with the weather parameter. And when the Wuhan virus at that point of time came about, and then we thought, hey, this actually fulfilled the criteria of disease X. It's going to be big, right? And one of the things that I had the opportunity to involve in at that point of time is we had this like what they call a playbook scenario. And when we did a playbook scenario, we start to realize in my WHO ITU group, it's not only consists of doctors, it also consists of policymakers, it consists of academicians, it consists of even in Malaysia is something equivalent to our Jabatan Pertahanan Awam, civil defense. Yeah? And one of the things that we realized very fast is that nobody know what the hell to do. Like nobody know what to do, right? They will be bombarded with scenario upon scenario, and this computer simulated model will tell them like, okay, day one is district A, and in a couple of days more, it's going to be district B, and whether do you think like there should be an inter-district restriction movement and whatnot? And for real, actually, nobody have any idea. And this is when we thought like we should further enhance our model in order to understand social viscosity. And what social viscosity is like in the absence of disease, in the absence of a pandemic, we need to understand how the population move, what are the population mobility, why they move in such a way they move, and for what basis. And if you put in certain restructure, then you can see like what kind of sector would later on will be embedded and what kind of
So you can simulate the model.
Yeah, so you can simulate the model. And I think in this way, you will have a more data-driven decision, right? One of the things that you really need to answer early on is how do we put actually the threshold, our action level? Like, for example, now we rely on this level that, if it is more than 40, then it's supposed to be red zone. Some basic question need to be asked there, like why is 40? Why is it not 35? Why is it not 33? Right? And this is the point where I think where non-health data would actually have more, I think it can give more insight rather than just collecting or tracking the statistic and the number tally of COVID-19 incidents every day.
Excellent, gentlemen, excellent. So laymen like me, right, we like to ask a question. We know that data is being collected everywhere, or everywhere there is data. So please describe the process or effort in terms of data being collected, cleansed, and stored. And the most important, what governance is in place? How clean is the data? How accurate is the data? Dr. Lau, please take the question first.
Sure. So one of the thing, right at the peak, I would say maybe in Malaysian's case is about March, April, that time, during that time that everybody is checking CoronaTracker at least 3 to 4 times a day. Is that everybody is like, what is going on? Is the number is going up, right? A little bit like where we are right now, but right now we are more our heart becomes stable a bit because we know that government, everything is in control, right? But back then, wherever we collect the data, people will always come to ask us, hey, how come your website is still, let's say, if reflecting 50, but the other websites, or my father received a WhatsApp say that there's another area or there's another report saying that the number goes up to 60, 70, something like that. All the messages are flying around WhatsApp. So one thing that we have to make sure is we only get the data from reliable sources. Yeah, that's the first thing. So we only get our data from either the government reports, okay. WHO at the time was quite not as fast. And then we get it from their official tweets. So most of the MOH or Department of Health, they are releasing this information in quite a timely fashion. Like, for example, in Malaysia's case, okay, we know that every day 5:30 we can expect to have updated results. And so I think from our perspective, we always aim for reliability rather than aim for the speed. And in data science, one of the biggest things that people always didn't realize is that data scientists spend about 60-70% of the time actually cleaning data, not to build a model, because once you have built a model, you just busy getting more data to feed the model rather than coming out with newer fancy model, which is not always the case.
So in layman's term, for me, it's like a factory. You build a factory and then you just put in the raw materials, is it?
Yeah.
Any charts?
Correct. Yeah. Data. I think for layman like Gopi, you can understand it. Like data is the raw material, is the ingredients, but the model is like a recipe.
Recipe. All right. Okay. Dr. Helmi, what is your view? How do you collect your data? How do you manage? I mean, you're collecting data all over from Brazil right up 3 continents, and you've got different diseases.
So actually, I was asked this question before, and some of you probably you find my opinion unpopular here. Right?
No. Please be open, frank, and transparent.
But if you will indulge me, I'm talking from the perspective of public health and also in the midst of public health crisis. So if you ask me that in a pandemic, right, good data means data that is timely, that is representative, it must be responsive to need, it must be sensible, it must be widely accessible to different parties, without compromising privacy, period. That's about it, right? And you are right. One of the biggest challenge in digital epidemiology is basically data acquisition. There's a lot of privacy concern when it comes to contact tracing, and likewise, health program managers, they are unsure. There can sometimes be at odds, like how much case or patient data they can disclose. Like, is age is a data that need to be protected? Is gender is kind of data that need to be protected, right? So they are not sure whether they can disclose this, even without revealing personally identifiable variable. And I also know from my previous work in dengue and whatnot that I know very well legislation cannot possibly outrun the virus spread. I cannot wait for legislation to be amended. What more is the consistent closure of the parliament at that point of time. So it can be frustrating, and hence in this pandemic, I resorted to some sort of a social experiment. Yeah, I resorted to a second institution, and what I did is I asked citizens directly to help build the data lake. In short, what we do is like we crowdsource. And I think for a lot of people they might have seen this, but I'm just want to share my screen now. So yeah, so I think for a lot of people, they might have seen the Selangor and how it is being used to collect data. And what it did in essence is like this is the entire idea of Selangor came about, right? You create a voluntary data lake as a safety net that later on you can refer to retrospectively if and when contact tracing is required, which is obvious. So we launched an early prototype on May 2 to the Selangor State Agency, and I think by May 5 we then opened it for public adoption. So I think the uptake was brilliant. It seems like the citizens are willing to negotiate some terms in terms of data exchange that in a month after its rollout, I think the government recognized this as a legitimate way of collection for the pandemic. Then later on, we see how the federal government replicate and adopt our approach using a QR code as method of data collection. This is not to say that all is fair and well. We must also remember we were quite at odds when it comes to PDPA. One of the things that it was at odds before because PDPA should, but it was not applicable to the state government at that point of time. So personally, I disagree with this. I think there are no reason why government should not be subjected to PDPA. And to close this gap, what we do is like we do something that what anyone with a sensible thought would do. We met the Jabatan Perlindungan Data Pribadi. We asked them to issue an advisory that later on we can comply to. So the advisory was out 20 days later after we launched Selangor, and we are happy to announce that we comply to each and every one of it. So I think that is a way of how we can, I would say like how we can calm public nervousness when they had to exchange their data with us.
Sure, something very new, public nervousness. So stakeholders, public's a stakeholder, so is the government, so is parliament, so is everybody, so are you, so everyone are stakeholders. So you are already alluding to the fact, the difficulty of managing stakeholders. What are the other difficulties, Dr. Helmi, you are having, difficulty managing other stakeholders as well? Were there difficulties in hospitals, with pharmaceuticals, or with data, technology maybe? What were the other difficulties and what kind of stakeholders were they?
It really depends on what are your target audience of the data, right? So if you're talking about stakeholder, and when you talk about data, there's actually one stakeholder concept. The concept is like how you make sure the data that you collect makes sense for them so that it can facilitate what they're supposed to do, right? So for example, if you are talking to a group of human contact tracers, so the ideas must be like, how can they identify the people to be called using your data lake? And if you task the local city council to monitor overcrowding or to monitor SOP compliance, so, how can they use your platform to give them an eagle eye view? So I think the first challenge was to understand what are the needs of every stakeholder. And, sometimes in order to fulfill their need, it means like you need to get an extra data from them. And that will be like the second obstacle.
Great, thanks. Dr. Lau, what has your experience been in managing stakeholders? Very difficult times. Everything is new. So how did you manage to handle the stakeholders and move forward very quickly?
So in our case, our stakeholders are not so much on the privacy itself, right? Because a lot of people they are keen to see things like, for example, the most common one, they'll be coming to us like, hey, Dr. Lau, can you include a prediction model or tell us when is the next outbreak going to happen and stuff? And they try to ask us about those sort of questions that which we have answers. Okay, we are able to answer based on the sort of data that we have collected, but we are not supposed to tell them too much information about that. And then one of the things, like different countries, for example, US, the way that they announce the numbers at the initial stage and at the later stage is totally different. Their attitude changes a lot. And you look at UK, right? You look at CoronaTracker today or any sort of public data, they just don't update their numbers on the death anymore. Okay, so it's something that is funny there. And then people will come to us like, hey, you are one of the porter that help to report these sort of things, and then how we should be answerable. And then sometimes there are some sort of like political issues as well. People are upset where we separate Hong Kong, Taiwan, and China into three different categories. That sort of things, yeah. So the problems that we are handling here is a little bit different. We are just facing the public. But let's talk about in terms of the stakeholders for privacy data side, right? We do have a lot of people, they have done the work like citizen journalism. They collected extra information and they wish us to put those information on the website, which we politely say no as well, because we don't want to cause unnecessary disturbance to the public as well. Although we understand that the data is collected through a proper channel, but yeah, we stick to what we believe.
So in your opinion, both your opinions, you think we have collected the data in the best possible way so far? Now?
Sorry, Gopi? Lost you.
In both your professional opinions, do you think we, as in Malaysia, we have collated and collected the data in the most professional way? That is the most accurate way?
I think definitely something can be improved, and in the way we have within Malaysia, we have spoken to different parties as well, like telco companies. They definitely have a lot of data, but we know that again for the same reasons, we shouldn't ask them to give us that sort of data. Like for example, we can also work with internet providers to get this information to see which are the hotspots that have strong internet or network activity, and then from that we can tell that there are people there, and during that time, like when we have the Thai MCO, they shouldn't be there, right? But yeah, we didn't go there. So I think in a way we collected, we handled, and we utilized the data properly and taking care of both sides. Yeah.
Right. Dr. Helmi, your opinion?
I think the data collection when it comes to COVID-19 cases, I think there's still a lot of gap that need to be closed. So we need to understand like how COVID-19 cases are being annotated, right? So the first thing is like you must suspect a person, right? And in order for you to suspect a person, it means that it must be traced to that person. So that was the first gap, like how efficient and how fast you trace one person, and how fast can you establish the epidemiologic link between the patient and the suspected cases. So that is already one thing. And then when you go there, and then like you have to reach out to them, you have to find out to probably put an appointment slot to collect a sample from them. Once you collect the sample, and then those samples need to be transported, it need to be processed. And what are the backlogs of your lab capacity? What if the lab is actually already on the brim of processing? So all of this actually is a pertinent question. And if you try to outpace the virus spread, the other question is like how big or like how wide have you tested the population that you determine, right? So whether those data collection can be further improved, yes, very much. It can be further improved. And the only way it can be further improved if we got some sort of statistic, like how wide, how timely, and what it is not. Because otherwise, the kind of data, the one that we are following day to day at the moment, we are treating our COVID-19 case report as if like it's a football scoreboard. Today we win, yesterday we lose, the next day we don't know. Like as if like we're going
as long as we don't get the red card.
Yeah, it's a great cut, and this is not supposed.
Yep.
I don't think we should put so much importance on what are the day-to-day number, because that probably can be quite meaningless. You want to see like how it stack against the baseline in a certain population, and in order to do this, we really need to improve our data collection more, so that, like I said, it can be timely.
So let me bring up a very a point that I'm pondering about. They say data is, when you do something like this, you also need external data.
Exactly.
So what kind of external data, or have you already answered the question in a subtle way? What kind of external data have you been, is it easy to get data?
Okay.
And where can you
So,
get them?
all right. So I think I will answer this question. I think I will answer this question with a use case, right? And probably some of us here might have heard of the circus on data exchange between the state of Selangor and then the Ministry of Health recently. And that was unfortunate. I have little comment about it, but I like to fill in some context. Yeah? You see, it has always baffled me regarding the basis of how some public health measures are instituted, like I mentioned just now. But I also understand, to answer all of those questions, those local contexts of an epidemic, you need to understand it by requiring external data. It requires anonymous patient location. It requires other non-health parameter like demographic, like number of premise and category of premise. Allow me to share some of my screen now. I'll share this so that you can better understand what is it that actually I'm talking about. Okay. So this is regarding our second. This is basically regarding our second solution. Yeah, the platform of inherent risk contagion. Okay, so how does it work? Is that we predict the dynamic and trajectory of COVID-19 cluster using inherent risk of contagion modeling. It's just a fancy word to say that we focus more to measure population vulnerability in order to predict cluster growth. So as opposed to the more conservative way of measuring only cases, we measure the population vulnerability. So this is what we used for previously in Selangor, starting from May to 27 September, to determine where should we deploy our tests, how do we determine our lockdown, and how to prioritize our limited health resource. Yeah? So this platform was in operation from May until 27 September, if I'm not mistaken, when the data blackout was imposed. And this is the risk when you run a machine learning platform. Yeah? Without the potency of data pipeline, you will always facing this kind of risk. The risk that your good solution is interrupted midway, and probably and mostly are for non-technical reason, like stakeholder differences or differences in opinion and things like this. So all in all, like, this is the kind of challenge that I experience when we need an external data.
Interesting. I look at the map. It's so. I just wish I knew one of these. I had the ability to do some of the things that you guys are doing. Dr. Lau, what's your opinion? Was it difficult to get external data for you? What were your roadblocks?
For us, not so much. For us, because we have the freedom to collect whatever we want, and at one stage we have about 4,000 to 5,000 volunteers from around the world. Actually, we have too much information. So the challenge here is
you had a crowdsourcing model, right?
Yes, correct. Yeah. So the challenge that we have here is too much information, and then we have to we have to find ways and use some sort of the manual ways combined with the machine learning ways. Machine learning, like Dr. Helmi said, is a fancy way to put things, right? Basically, it's just rules. So we need to find out a ways that, okay, for example, if somebody tell us there's a spike in a particular country or particular area, then we need to set a baseline, say, hey, this number is, let's say, 20% above what we have predicted, or 20% more than what it was yesterday. Then it raised an alarm, right? It triggered us. So the way that we see CoronaTracker and using that as a system is like a security system, like an alarm, right? You do, whether you want your home alarm to be very sensitive, like even a cat walk past, it will ring, or you want it to be so sensitive that even a smaller sized guy that walk past and then it doesn't trigger an alarm as well. So these are the challenges that we want to handle. Yeah, we are tackling here.
Dr. Helmi, you are agreeing to it as well. So you challenge?
Sorry. Can you repeat the question? There was like some background set.
You were nodding aggressively, so you were probably having the same challenge as well.
Yeah. I think exactly. I think like that is what Lau just mentioned. Like really go in line with what I was talking about, right? So, for example, I will give you another use case, right? Another use case is like the use case of SOP compliance, right? So you see, up until now, there were no objective or representative method on how to quantify SOP compliance. Every day, you heard the authority like telling people like like the citizen not comply SOP and whatnot. And some academician, for example, they have seen how some SEER model or this model of outbreak prediction estimate what are the number of population if 70% are compliance or if 50% are compliance. I have one question. How do you know the current rate of SOP compliance? Like there are no measure to that, right? So that a proxy measure by policy or by police compound is probably skewed, yeah, and not representative for many reasons. So again, that is what we do, right? So what we do is like, if you have ever used Sri Lanka, then you would found that we actually run a survey time to time, and when you run a survey time to time, yeah, when you run survey time to time, what you will be able to find out is like you'll be able to find out like, okay, what are the rate? Basically, you turn the public into the eye for the authority, right? So you ask the public to see like how many people they see not wearing masks in certain premises and whatnot. Yeah, and then it will allow the authority to have this eagle eye view, which area experience a breach and which area is not. Yeah.
Oh, very good, great, exciting. So, gentlemen, tell me, it leads me to think about probably how do we defeat that? How do we plan better? What are your key learnings in developing solutions for the purpose of action or dissemination of insight? Not just COVID-19, I mean, any epidemic, yeah? Dr. Lau, could you tell us your ideas of how you think we could do this better plan? How can we educate our stakeholders? How can we move this forward? Everything is going digital, right? So are our laws too archaic? Do we need to change? What's your advice?
Okay, I would like to add something to what Dr. Helmi have mentioned just now. Is that what he has mentioned is a very typical classic use case, and if we take that to a scale, right, you can easily see a pattern. Those people who are at the low risk, right, they think I'm fine, they go to the place, they scan the QR code, they pretend, I'm not saying who lah, but you definitely know somebody at the restaurants, at the cafe, they scan it and it's like okay, they walk past with their barcode and they go, right? There's one group of the people that's like that, and there's another group of people, they know that they are high risk, then they will also try to avoid scanning it. So whoever they scan is those people who are somewhere in between, in the middle, yeah, if you look at a normal distribution. So I think that's one of the key thing is like, when we look at those people, let's say they received the summon from the police, right? These are survivor bias, basically, if we study them, because we are basically study those people who got caught. But what is the numbers or what is the percentage of people that they weren't caught? Yeah, so those are the things that is important. And if I were to summarize my key learning throughout the whole process is always trust the data. Data travel faster than the pandemic. Okay, and the second thing is always have faith in the government. It doesn't matter which country you are. We have people from South Africa that comes to us. They say, our government is not reporting the right numbers. And then we have some Eastern European countries, Egypt, Brazil. They come to request the actual data from us, which we give them to whatever we have. But when it comes to like dissemination of insights of COVID-19, these sort of things, right? We as an individual, we should just listen to what the government is advising us to do, because whatever government have decided is the way that is the best benefit and concerns for everybody. Yeah. So we individuals should not just we should be participating. Yeah. We should be concerned about those things. But when it comes to doing what or not doing something, right, just follow the SOP. That would be the best way.
Very good. Very good. I want to ask you a cheeky question. So we are going into predictive analysis. So if you can come to a stage where you can predict who is going to be breaking the rules, who's breaking the SOP, and you're waiting there, that's amazing predictive analysis, right?
Yeah.
So I want to get back to my former question. How do we do this better? How do we collect data better? What kind of advice can we give our stakeholders, be it the legislators or be it government, be it lawmakers? How can we? Because I understand our legal system, our rules, our regulations. It's quite archaic. The technology is moving so fast, and so are the citizens. We all using. We've already gone on mobile. Everything is mobility now. So, what kind of advice would you like to give to our stakeholders? Dr. Lal, I'll start with you.
Okay. Now, if we were to start doing something like, let's talk about digitalizations, right? A lot of the companies, and let's say we talk about SMEs, they're mistaken about the concepts between digitalizations and digitization. So they thought, I send emails and then I did my stuff on Google Sheets, and then I've done my digitalization process, and then I'm on the cloud. But the main thing is not. So I would like everybody to start thinking from the culture wise. So if there's anything that you can avoid a physical presence, avoid a physical meetings, then let's try to avoid that. That's one way to reduce that. And then from the data perspective, right, do make it a habit, because don't just think of it just from the privacy. The people are funny, right? When you install an app, they ask you to read 37 pages fine print, to play a game, or to replace your face with some celebrity. You click OK without further thinking. You just okay. But when it comes to government just asking for you to scan a barcode before you enter something, that's not only for your benefit, it's for the benefit of the whole country, if not all the mankind, the entire mankind. So we should be more collaborative and cooperative in that sense. So there's nothing. Okay, put it this way, from a data science perspective, right, the technical challenges here, I think Dr. Helmi will agree, is nothing, right? The model is matured. We just need more reliable data, and people just be honest, and I think we'll be fine. And then we can fight the virus.
Dr. Helmi, your opinion?
Well, I think there are two key points that I want to deliver. Like the first one, especially for the practitioner the practitioner of public health and also the practitioner of data, is that number one, there are other ways to mine useful data when it comes to finding pattern on population health. So a lot of data practitioners, they figure out that, the only one we can do population health, if we go to Ministry of Health and we get some data from them, you can forget about it. Most probably you would not be successful. Yeah? But do you know that a person contact with healthcare system only account to 20% of factors that influence their health? 40% is determined by your genetic and personal risk behavior. The other 40%, and this is where it got interesting, the other 40% is predetermined by your environment, by the condition where you grew, where you live, where you work, and how you get old. This is not a novel idea. WHO actually called this a social determinant of health. And there's already swaths of publicly available data to be mined. My professor, when I was in Liverpool, mentioned to me, what are the most important number for an individual for us to determine their health outcome? A lot of people thought it's a date of birth, right? Because, it depends. If I born in 85, it means like how old I am now, what kind of disease I'm going to encounter. No, the answer is the postcode where you live in. The postcode where you live in actually determine your health condition more than where you were born before. So no, you don't need a data lake equivalent to what Ministry of Health have, or you don't need a data lake equivalent of a tracing app granularity to start applying machine learning for health. So that was the first lesson. And the second lesson, this social experiment thing that I started, I sometimes I feel a bit anxious about it. Yeah? That crowdsourced data, like the one that we pioneered in Sri Lanka, it can become a valuable data lake for public health. It's quite crucial when we are talking about tracking real-time infectious disease, right? But as much as thing like Sri Lanka was successful in deployment, I will risk a humbling observation. It's a very good proof of concept. It's very good social experiment. But the way those data is collected and annotated, I think how the terms are negotiated with the society must be rephrased so that we can keep it in long term and we can analyze it longitudinally. So yes, you can still use a crowdsourced model, but the structure of how we collect those and how we keep those must be revised. And it
Right.
must be turned into something that is societal and consent driven. WHO and also IQ, they have brushed this idea. It's something that we talk about. It's a big idea, but necessary idea. It's called a social contract for AI in health. So it's radical, but it's not so new. It is basically a national contract that would express the entitlement and obligation of all participants within healthcare provision system. So in a way, like it is something that you opt out from rather than you opt in. Yeah. It spells obligation for individuals. So it means like it spells obligation for everyone. You need to scan. It become a normative thing, right? But in return, you get the advantage of AI-enabled health system, something that turned into a public good.
Fantastic. Thank you. That was very good. Thank you very much. I'm going to take a break. You know what? You guys must be fantastic because I've got tons and tons of questions. I don't know where to start. Tons of questions. So, all right, I see one from Muhammad Azam Hassan, CEO of AGA Touch. Dr. Helmi, I think this is for you. My Sajatra claimed 4% detection from positive cases. What is the rate for Sri Lanka?
This is something that I actually already answered in my tweet. Let me be clear. I don't believe it's 4% from my Sejahtera. I think it must be better. And the reason I'm saying this was because during the peak performance of Sri Lanka, when it was the major contact tracing ecosystem in Selangor, we do run some retrospective analysis. And what we found out, I do actually disclose on how we calculate those rate, but we know about 56% of the cumulative cases that was tracked in Selangor at that point of time is something that can be tied back to Sri Lanka, right? But our penetration is way smaller. Our usage rate is way, way smaller. So I'm very confident that my Sejahtera, their effectiveness rate must be more than 4%. It must be closer to us, if not more. I think the only thing that they need to do is like to go back to the drawing board and see how they annotate a case is actually something that can be attributed to my Sejahtera functionality. I think 4% is probably too low. Yeah.
Okay. I've got a second question. I'll leave it to one of you or both of you to answer this. This is from Captain Ko, Executive Chairman, Europex Asia. He says, let's get real. When we start to vaccinate our Malaysian population, we will need to have their particulars and identity. Otherwise, the vaccine will not be able to reach all of the entire population. How are we going to get this feedback? I think he's referring to the PDPA you mentioned. Gentlemen, one of you want to answer, both of you? Who wants to dive in?
Maybe Dr. Helmi will be the better person to answer this.
Yeah, I'm a better person. You guess so. So, well, you see, when it comes to vaccine, it's probably makes sense for us to be more humble about the digital role in vaccination, because when it comes to vaccination, depending on what kind of disease, for example, with measles, right? In order for you to control measles, you need to have a 95% of the population covered by the vaccine. And in order to do this, if you rely purely on digital system, you will understand that the last frontier of our society usually is not within this digital net, right? It still rely on our community health workers to actually reach out to those places. Like probably like sometimes they have to take boat. I used to work in an Aboriginal village, and let's not talk digital. It's even hard to get a phone line there. Yeah. So so the role of, I think, how digital can play a bigger role in terms of vaccination rather than ensuring coverage, because it's something that I think the health sector, the community health workers have very good experience on. But I think what digital health can focus on more is in this rising of people who are within the digital scope, who know they need to be vaccinated, but who are refusing to do it. I'm referring to basically the anti-vaccine group, yeah? And anti-vaccine group, anti-vaccine rhetoric and movement, this spread like wildfire, especially within the digital network. So this is something that probably like we have more...
Huge group?
Is easy. I think rather than we call it whether it's a huge group, I think the growth of it is something that is definitely worrying. Like the number of how it grow from 1 to 1 is definitely growing. And how do you find them in the first place? And what kind of ammunition that you have at the moment to control that? Because at the end of the day, it's basically differences of opinion, right? This is something that I think would be more tactful for digital to counter.
So even if you make it mandatory, it's still going to be tough.
They're going to be tough. With measles back in 2000, in 2013, there was a big measles outbreak in Klang. I was there as a doctor in PKD, Pejabat Kesihatan Daerah, and I thought it was only the question of finding who need to be reached, right? And we managed to locate them. But then I have no answer when I managed to knock the door, and then the parents say to me like, no, I refuse for my children to be vaccinated. This is not something that I have a ready answer to, right? When you ask them, and then they will tell you like, we got all of these insights, something that they discover from Google, from Facebook group and whatnot. And what do a doctor can do?
Interesting. All right, we'll go on to thanks, Doctor. We'll go on to the next question. Maybe I'll get Dr. Lau to answer this. This is from Shalene Chong. She says, hello, doctors. Assuming by 2021, vaccination has successfully managed the pandemic spread, what happens to the data? Example, Sri Lanka, you have collected. What happens to the data you have collected? Ethical considerations aside, the data opportunities are tremendous for social programs. What is your opinion, Dr. Lau?
Okay, so you can never have enough or too much data. If you look at what Google, Facebook, all the big boys are doing, right? They're trying to gather as much data. I think gather is no longer a right word. Probably harvest is a better word, right? So what they are trying to do here is the more data that we have, that you have access to, then you can build a more accurate model. So all these data that we collected now, and I think we should be continuously collecting them until for better futures, and more people should be willing to contribute their data to the data lake that we are building. And let me give you another example. I think continue with a good question that Gopi has asked earlier is that how else can we use those data? If you remember a few years ago, we have been talking about big data, that sort of things. And then if you look at something that we have been talking about, blockchain in the past few years, right? Look beyond Bitcoin and that sort of stuff. If we have a system that can record those data that is immutable no matter by which party, and we can combine them together, let's say we look at a particular area in, let's say Pahang, and then suddenly a lot of people are rushing to the pharmacies to buy Panadol. Actually, this is a similar scenario that we have witnessed earlier. A lot of people in different countries, they start to buy masks, and then we don't know what is going on. We just see a lot of message on Facebook saying that, hey, do you have masks? One piece of mask has gone up to like 3 or 4 ringgit, and then the hand sanitizer, that sort of things go up to like 10 ringgit a bottle. These are all signals. And go back to Shalene's question is that, yes, this data, we will continue to use that as part of the source, the data source for our model, and then we can build a much better model and to better prepare ourselves next time when something similar hit us. There will always be another coronavirus, there will always be another pandemic, and at the rate that we are developing, I think it's going to be faster and faster.
Interesting. I probably have time for one question, one more. Let me see. We have a question from Nurul Akma, trainer from Intan. What type of personal data, I think you answered this, but maybe we'll answer it again. What type of personal data other than demographic information is basically being collected now and processed during the Covid-19 outbreak? Dr. Lau?
I think probably Dr. Helmi, because our side, we collect the statistics.
Yeah, I think... I think for the person who questioned, who laid out the question just now, right? Obviously, I cannot answer for any other platform that I'm not managing. Yeah, I cannot answer that. But I can only answer for those platforms that I'm involved in, like for example, Sri Lanka, and also the cluster tracking platform that we are working with, Selangor Task Force. And it must also be important for you to understand like how. What does it mean by personal data, right? So personal data are those data that can be directly linked or used to identify you as a person. So whether demography is a personal data, it probably is not. If I say that someone is 20 years old, there are so many people who are 20 years old. If I say someone who are Malay or someone who is Indian, there are so many of those people who are Malay and Indian that cannot be used as your identifier. Obviously, there are some identifiable data that we need to collect. So, for example, I would say, for example, the first thing that we need to collect was phone number. Phone number is something that can directly be used to identify you. This is where what I've mentioned earlier, there need to be a certain social contract, a certain social contract between the user and between the authority. Like, I am willing to give my identifiable data, even though it is not needed now, yeah, because it is not needed at that point of time. When you go into a shop, there's no reason for the government to collect your data, but you are giving it in advance just in case later on, if there will be an outbreak, you would be reachable. Huh? This actually is something that was a bit conflicting when it comes to PDPA, because when it comes to PDPA, you must always tell in advance like why and how you are going to use the data. It must be something prospective. While in our way, like it's something retrospective, and this is why we met the PDPA. We asked them to come up with an advisory, and you have to tell them like this is how contact tracing works and how a certain clause need to be reformed so that it will be in line with the PDPA that we have now. Other than that, the data that we have, so for example, in the citizen of Selangor, in the early March when there were a big outbreak on Hulu Langat, at that point of time, the only two risk group that we found at that point of time was the elderly. And we have no option at that point of time. You need to map out where are all the elderly living, so that you would have like a visualization, like where you should send your community tester, right? Where you should send your community nurse, and this is where we actually get certain data, especially from those who receive the Skin Mesra Usia Emas. So there are this welfare package from the state government for the elderly, especially who live alone, who receive this sort of welfare from the state. And then at that point of time, we had to take into their name, we had to take it into their address, we had to map it out, and then we had to see the trajectory of the outbreak, whether they can be affected, so that you can send a team to proactively screen them, but not everyone on your turn, without waiting for any contact tracing to be done. So this is two things that are very different. Contact tracing is when there's already a case and then you move backward, while ACD or active case detection is like when you do this kind of exercise, you look at it prospectively and then you send a team to basically mass survey the community.
Fantastic. Thank you. So, gentlemen, you've definitely attracted a lot of people on to watch us today, a lot of questions. So I'm going to ask you a bonus question, right? This is more to inspire, because amongst us here and who are watching you today, a lot of startups, a lot of tech guys, a lot of students. So I think these are students who are inspired by data sciences. So I'm going to give you each a bonus question. Take 30 seconds. Dr. Helmi, inspire students. Tell them about data sciences. Should they not pursue? And what part of data sciences should they pursue? I know you've got...
you should pursue.
Go for it.
All right, so this is my experience. I'm a medical doctor. I have no expertise at all when it comes to coding or when it comes to machine learning or when it comes to build algorithm, right? But I'm a subject matter expert. I know what kind of gap that I'm looking at. So for students out there, it doesn't matter. You don't have to be in machine learning, actually. You probably like in history or you're probably in biology, but in the field that you are, you will find a problem. And during that point of time, you must understand how you can use data to answer your problem. And at the heart of it all, right, citizen, individual like you and me, we must have bigger say how we like institutions to manage our data. Not only how they store, not only how they protect our privacy, but also how they utilize it and how we want it to be shared for mutual prosperity. Securely, of course, right? So this is the call for our generation. After all, like the name of this session, I think the session is called Our Data. It's data kita. So it should be up to us on how we like to see it being used.
Thank you. Dr. Lau, what is your message to these students?
Okay, now I'm on the I'm on the totally opposite of Dr. Helmi, right? I'm a data scientist. I know how to play with data. I know how to get anything from the data that I want to, as long as they give me data. Now, and how did I eventually become, because I have an interest. I have a passion in using data to help to solve problems. And then, so I use that's how we and the medical doctors and all the epidemiologists work together. Is that hey, we know how to analyze those things, and then we look at data to find some patterns and interesting trends, and then we work with them. So your role, you as a student, right? Don't worry about how government is collecting and handling your data. Facebook, Google know you a lot better than what the government knows about you, right? Yeah. So I would love you all to keep that spirit and be critical when you are developing your own data solutions, and also be critical when you use Facebook and Google application, because that's how we grow, right? Our data literacy. And one last thing is, in today's world, it's very easy to find answer. Google know everything, right? So I want you all to think about how to think critically and ask the right questions when it comes to a problem. Thank you.
Critical thinking, problem solving.
Yes.
Good. Gentlemen, I just want to the audience there, I just want to say that this month of November 2020, for MDEC, it's called the Malaysia Tech Month, and we have got lots of programs. And our tagline going forward is Malaysia, Heart of Digital ASEAN. And ASEAN is a huge market out there. And when you talk about a huge market, there's a lot of data. It's a data ocean. I am really inspired by the both of you. So, we are showing ASEAN that Malaysia, we have innovation, we have talent. Look at the both of you, very young talent. Look at the innovation you're doing at this age. Look at the disruptive technologies you're using. Look at the language you use, right? So we are showing ASEAN, Malaysia is the heart of digital ASEAN. And what more? Now there's probably a new tagline, Malaysia got talent. Because of both of you. So these are the kind of things that we want to showcase. You guys are doing amazing. But before we depart and before I do my closing, I want to do a Wi-Fi. I don't know, groupie, all these new things I don't know. So can you click on that button at the bottom somewhere there? Okay, I initiate and group file, start group file. Okay, all of us take photos, please. All done?
Use this one. Yep.
Okay. 1 minute. It's doing something. It says save photo. I save it. I think it's going into Twitter. Oh God!
All right.
All right. Okay, time's up. So, guys, thank you so much. You guys have been good. I just want to do a wrap up. I just want to say that I learned a lot. I learned so much, and it's been very amazing speaking to both of you. You've been very inspiring, very knowledgeable, and thank you for sharing the nuggets. All I can say is I think that data is a foundation for providing insights and decision making, and the good data with appropriate management and governance of data is a requirement to address the concerns of various stakeholders. And I think the message is loud and clear. With that, time's up. Gentlemen, thank you very much. We'll see you soon.
Thank you.